The fact is that because there is no true universal cause for depression, it is impossible to find a definitive treatment that can be beneficial to everyone in the world that is suffering from a depressive symptom. Because of this reason, there's a focus that is more geared towards finding what factors can be related towards increased depression and finding multiple intervention strategies and treatments that can be suited or tailored to each individual to better cope with these depressive symptoms. Some of these factors are a person's environment, a person's specific situation, such as their social status or their economic status, any past or recent traumas that a person may have that may alter their mood, and any other comorbid health issues or disorders that can be as well causing or strengthening a person's depression. In terms of students, it is evident that not every student needs the same help for their depressive symptoms, and not every student knows when or how to seek help for their depressive symptoms. In fact, although it may seem that it is very easy to recognize depression in a person or depression in oneself, there are several roadblocks that a student has in their life that may not allow them to either recognize these symptoms or go out and seek help or go out and seek understanding of what it is that they may be feeling. Some of these roadblocks may be lack of time or increased devotion to studies, and then not wanting to use that little time that they do have between balancing a job and school and a social life to actually research depression and research something that they may be feeling and thinking that maybe it's just a phase and it will go away. Because of this reason, an intervention strategy that we propose is a free application. It is named Auxilium. And Auxilium, which is Latin for the word help, would be the go-to source for students to use in terms of not only understanding what depression is and learning more about the criteria and basically like the gist of what exactly it is, but also learning how to effectively cope with it by using different strategies and possibly seeking treatment or professional help. Instead of conducting 100 Google searches for a student that may be thinking that they are actually depressed, we would propose to download this app, which would contain detailed and organized information on not only what depression is, but the diagnostic criteria. And then if a student feels that, wow, maybe I do have this criteria, they can learn about effective strategies to cope, or maybe I do follow this criteria, I'm sorry. They can learn about effective strategies to not only cope with the disorder, but they can also actively search for certain intervention strategies that they may feel is right, or even professional help from a therapist to get another voice, another more experienced person speaking that can actually make a diagnosis and tell you whether you have the depression or not. We believe that Auxilium is not only necessary but very beneficial to everybody, especially these young adults who don't have time to be researching about depression, who don't have time to be looking for possible ways to intervene with their depressive symptoms. And we believe if we can find everything and all this knowledge and put it into one app, which can be easily accessed from a phone, take it right out of the pocket, just open the app, you can learn not only what depression is and how it may be affecting someone's life and whether you have it or not. You can also learn how to cope with it, and you can start actually coping with it straight from the app. We believe that the accessibility of the app is the key to this intervention. Not only will the use of Auxilium lower depression rates among students, it will make it so that even other students and not it will make it so that even other populations, not just students, can also access the app. The fact that people are able to learn about the depression or learn about the disorder and then actively seek any effective intervention strategies, which can be more specific, such as any proximal support groups around campus, or seeking the professional help of a therapist or anybody that is licensed to talk to you and give you a better understanding of the disorder, would be beneficial to everybody that is possibly feeling these depressive symptoms and doesn't exactly know what to do.